My name is Kenzi Marshall, and today I'm going to present 2 ways on how to prevent pressure ulcers. According to Peterson 2012, it has been estimated that $11 billion are spent on pressure ulcer treatment each year in the United States. Some of you may ask, what is a pressure ulcer? Agrawal 2012 gives a great definition. A pressure ulcer is commonly termed as a pressure sore and sometimes as pressure necrosis. In other words, when a patient's skin breaks down and gets injured, it is classified as a pressure ulcer. This brings me to my 2 main topics, of which are moisture management and offloading of pressure. Drew Payne 2015 stated, moisture is anything from perspiration, urine, feces, or discharge. A main point in the management of moisture is to keep patients dry. A critical step in the prevention of pressure ulcers is to do regular skin assessments to decide which products are to be used. Once a product, such as a cream or ointment, is decided, it must be applied when needed to the patient. In addition to topical products, pads that wick moisture can be put under a patient to keep moisture away when the patient is incontinent. When discussing offloading of pressure of a patient, this is in regards to a patient that is partially to completely immobile. It is essential to keep a patient moving, whether you are able to assist the patient up and moving in the room or to turn and position them in the bed. These 2 things are used to keep the patient moving off bony prominences, which could break down the skin. Many types of pressure distribution devices are used. Tanya Fernandez 2007 discusses them. Pressure relief mattresses, gel seat cushions, and heel boots. All of these are used to decrease pressure in the patient, which could lead to breakdown. As shown here by Tanya Harrison 2013, the acronym SKIN is being used. Each letter represents a main area that can be focused on. S is for skin and surface. Inspect the skin with regular skin assessments. As discussed before, regular skin assessments are necessary. Scales have been used to discuss these, such as Braden, Cubbin and Jackson, Norton, and Waterlow, of which Ami Kashim has discussed. Always assess the position of the cushions and mattresses that are available to help prevent pressure ulcers. Check linens for wrinkles or creases that could cause pressure points. This is done in regards to when the patient is in the bed. Make sure there's no pressure under them. K is to keep pressure and keep patient moving. This is done in regards to turning and positioning or assisting the patient when walking around to prevent pressure. Minimize shear friction. Use correct lifting technique. Patients do slip down in the bed and they do need to be repositioned so they are at the correct height. This is what has been used. The correct lifting technique is to make sure no shear is being done to them. Reposition the patient per hospital policy. This is to keep patient off bony prominences when discussing their pressure areas. Encourage the patient to keep moving if possible. If they are able to move themselves, have them do so. I is for incontinence and moisture. Assist patient to use restroom. Always assess if correct continence products are being used. This also goes back to the risk assessment of what products to be used. Keep patients' skin clean and dry. This is in regards to their pads that are placed under them. Make sure those are dry and there's no areas. N is for nutrition. Assess the patient's nutritional state and keep the patient well hydrated. The importance of moisture management and offloading of pressure is pointed out in this presentation. A simple acronym SKIN can prevent minor skin issues, which do not seem like much, but will prevent major issues in the future. In conclusion, nursing staff is key when protecting the skin from moisture and breakdown, and the offloading of pressure on bony prominences will decrease the amount of breakdown. Thank you.